responded directly to Selah on Instagram, writing, quote, Israel is not a state of all its citizens. According to the basic nationality law we passed, Israel is the nation state of the Jewish people and only it, end quote. The comments came days after Israel banned an alliance of Israeli Arab parties from fielding candidates for Israel's parliament, and as Israel is just 1 month away from a general election. Partly to mostly sunny this afternoon, mainly clear tonight, lows 30 to 36. Currently, it's partly sunny, mostly cloudy, and 58 degrees. Darnia Samuels will have headlines at 2:55. Stay tuned for To Your Health with Dr. Theodore Watkins. I'm Askia Muhammad. Thank you for listening to WPFW, Washington.
Whoop, tap, 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 whap, bop, tap, tap, tap. Rosemary in the bag, tied around my neck for my protection. I'm walking around, big old sack on my back, coming in your direction. What kind of tea do you like? I got it. I'm the medicine man, herb from the land, yeah. Oh, I'm the herb man, come see me. Oh, I'm the herb man, you all come see me. See, rosemary, calm your nerves, got peppermint leaf to get rid of my fever. I keep periwinkle to get some love now. Oh, I got hug me clothes to make my backbone strong. Gold cola tonic for my blood, dandelion for my bones, y'all. Alkali to keep away flies. Hot lady cayenne for my pressure. Oh, I'm the herb man, come see me. Oh, I'm the herb man, you all come see me. Get the children out the way now. No, you can't smoke this, sir. This is for salad. Yes, salad.
And good afternoon. Good afternoon. This is Dr. Theodore Watkins, and welcome to another program of To Your Health. We're excited to be with you today, and we have another interesting program. I don't want to say exciting because we're talking about diseases. We're talking about people's lives. But I guess in a way it's exciting because what we're going to end up with is talking about how to reverse disease. So I guess that is exciting. Today we want to start out talking about cancer in women, and particularly we want to talk about breast cancer. Now, let me just give a little background on what we're looking at. You know, they've done a lot of research, and they found that in 2018, last year, it was estimated 1.7 million new cases of cancer was diagnosed in the United States. 1.7 going on 1.8 million new cases, and most of them were cancers of the breast, the lungs, the prostate, and colorectal. You know, and the research also showed that that black women were at greater risk than white women of, one, developing cancer, and two, of dying of cancer, breast, colorectal, lungs, cervix, you know, and that the lowest risk was in the Asian population. You know, it's estimated that the new number of cases will go from 14 million to 23 million by 2030. Breast cancer is the leading cause of cancer death in all women, black or white. And the incidence of breast cancer is actually lower in white women than in black women. The incidence, that means the likelihood of getting the cancer, is actually lower in black women than in white women. But the death rate is higher because these cancers are detected at a later stage. The 5-year survival for black women is 71% with breast cancer, whereas it's about 87% in whites. But if you get the cancer before it's spread, that 71% goes up to a survival of 89%. So that's very, very, very important, you know. But the unfortunate thing is it's found that about 44% of black women, when they come in, they're diagnosed, the cancer's already spread, all right? And that number is compared to about 10% lower in white women. There's a lot of controversy now about breast self-examination and mammograms, but I still recommend my patients to examine their breasts and to get mammograms. I know I want my wife, my daughters, my mother while she was living to get a mammogram. It is recommended that black women undergo their first mammogram about age 30, which is about 10 years before white women, to try to detect this cancer at an earlier stage, you know, and that's very, very significant. All right, so we need to recognize that this whole issue of cancer is significant. But imagine that you've been diagnosed with breast cancer, and your doctor tells you that there's a new experimental treatment that can actually cut your chances of dying from 16% to 4%. All right? So you've just been diagnosed. And in other words, the doctor says, I can cut your chance of of dying 1/4. What would you do? What would be your response? Well, if the doctor says eating broccoli, then that's really something that'll do it. They found that if you put women on tamoxifen, 1 of their 5 servings of fruits and vegetables was broccoli, cauliflower, collards, cabbage, kale. Just doing that will cut the risk of recurrence in half. Eating 1 serving will cut it in half. And about 1/3 to 1/2 of women diagnosed with breast cancer make healthy diet changes important. And these changes include eating more fruits, vegetables, and consuming less meats, fats, and sugars. But only 1/3 of the women will do this. Women Eating Healthy and Living Study, they looked at a few thousand women with breast cancer. And what they found was that eating